Congress has left Washington without progress on what many consider its single most important issue this year, health care reform. Tonight, Chief Congressional Correspondent Mike Emanuel tells us how some Republicans are taking a piece-by-piece approach, trying to get something done.
With lawmakers out of town for August, Missouri Republican Senator Roy Blunt says the focus has shifted to steps Dr. Tom Price can take, some 1,400 instances in the law, giving the Health and Human Services Secretary discretion to make improvements.
If there's any way that they can be better for families, more economical, more competitive, so hopefully we'll begin to see that happen and have impact.
The Senate Democratic leaders expressing confidence in the plans of the leaders of the committee that oversee health care reform to address short-term health insurance problems.
They pledged the Health Committee to the task of restabilizing and strengthening the markets.
President Trump has threatened to withhold subsidies, pressing Congress to act. The committee's top Democrat says upcoming bipartisan hearings will be critical.
There is a lot of work we need to do for patients and families we represent, especially when it comes to the uncertainty in the markets and threats from the administration.
South Carolina's Republican Senator Lindsey Graham is pushing his proposal to allocate health care money to the states.
4 states get 40% of the money: New York, California, Massachusetts, and Maryland. My block grant approach takes the money we'd spend here in Washington, sends it back to the states in a more equitable fashion.
Blunt, a member of the Republicans' leadership team, says lawmakers could back Graham's idea if 34 Republican governors and 1 independent get behind it.
If all 35 of them come to the Senate and say, we want the Graham-Cassidy plan, that would be the best thing that could happen. And even better if a few Democrat governors would join them.
While many Republicans want to move on to tax reform, some in the GOP are predicting a rough reception back home for lawmakers on health care. So there may be a window of opportunity and serious motivation to get something done. Chris?
Mike Emanuel reporting from Capitol Hill. Mike, thanks.